Katie Dackler.
Kari, you're on speaker.
Okay, Ms. Knopf, you are good to go.
Okay, so good afternoon, everyone, and welcome. Just a couple of housekeeping reminders before we start today. I just would ask that you please speak loudly, identify yourself for the record prior to speaking, and please mute your computer if you're not speaking. And then if you've joined us by telephone, I would request that you not use the speaker option if at all possible. So I'll call the November 9th, 2020 special Grand Forks County Commission meeting to order, and please note for the record that all commissioners are present. The purpose of our meeting today is twofold. It will include information sharing or roundtable discussion between Dr. Waltz, Grand Forks County Health Officer, our local institutional community leadership, public health, community members, and the Grand Forks County Commission relating to the continued spread of the COVID-19 virus, which is overwhelmingly affecting our community. Secondly, the meeting will afford the Grand Forks County Commission and Dr. Waltz the opportunity to have an informal informational discussion as it relates to the process of implementing a face mask mandate for Grand Forks County. Because Grand Forks County is not a home rule county, the Grand Forks County Commissioners do not have the legal authority to issue mandates that have the full force and effect of law, meaning applying enforcement penalties for noncompliance. Mandates of that type can only come through a governor, a mayor of a home rule city, and or a local county health officer. And so for that reason, the Grand Forks County Commissioners have invited Dr. Waltz, Grand Forks County Health Officer, to visit with us today to discuss the probability of an enforceable mandate with respect to face masks and to receive clarification as to the pathway to make that happen. Ultimately, the decision to mandate face masks is made by the Grand Forks County Medical Officer, and whatever that decision may be, Grand Forks County Commissioners will respect and support that decision. The County Commission felt that it was important to include valued partners and community members in our discussion today with Dr. Waltz. And while we fully recognize and applaud our institutional partners and many other business entities who have established very sound, well thought out and creative COVID mitigation plans of action benefiting our community in many ways, we recognize implementing a countywide face mask mandate with consequences also affects all of you. So your input and your thoughts are important to this decision. As leaders in our community, we need to consider every avenue we have to facilitate and support an effort to combat this devastating virus. We have to be more than proactive. We have to be of one mind and all moving in the same direction together. And so we'll begin by calling on Michael Dulitz, Grand Forks Public Health, to provide us with today's daily report or update from the Grand Forks County Public Health Dashboard. Michael, do you want to start?
Yes, thank you so much. Chair and members of the Commission, my name is Michael Dulitz. I'm the Opioid Response Project Coordinator at Grand Forks Public Health, and I'm pinch hitting as the data and analytics leader for our COVID response. I'm going to share my screen so everyone has a chance to see the data that I'll be presenting. But here's a quick update on our COVID dashboard, as well as some key indicators I'm following beyond what you get in the COVID dashboard every morning. So as you can see from the as you can see from our dashboard, we are firmly in the red or severe risk category. We have been in this category for nearly 2 weeks now, aside from a couple days where we did dip it down into orange briefly. We are still seeing a continued increase in the number of new cases. We still do have good testing performance. Our percent positivity is increasing, and we are seeing an increase in our percent change. When you look at what those increases look like, just comparing from last week to this week, what I would have presented, for instance, at City Council last week, we were at a 191.5 case rate per 100,000. We've increased by 25%. When we look at our tests, we've increased by 2.3%, and our percent positivity, we've increased by 22.9%. We have added over 1,000 cases in the past week of COVID-19, which is by far the most that we've seen in a week. Comparing that to other North Dakota counties, Grand Forks is kind of firmly in second place right now. Ward County's been experiencing a pretty significant increase over the past couple of weeks, and they have been seeing the definite impacts of that, particularly in their hospital system. They do have a challenge with not having adequate testing compared to us, and so they may not be finding the same number of COVID cases as we are. And then compared to the state, we are still significantly higher than the statewide rate of COVID-19 cases as well. Looking at our percent positivity and comparing it to other communities, our percent positivity has remained much lower than Ward County, but is following along with what Cass County and the Bismarck area is seeing as well as the state in general. So running right around 15%, which is very high given the amount of testing that we are completing. Looking by age group, again, we're seeing a general trend of the COVID cases following kind of the same upward curve, regardless of age group. This is a particular concern in the 60+ age group and the 0 to 19 age group. Again, those are two groups that we value very highly on trying to avoid getting COVID in those groups because of the potential impacts both on education for children and mortality for seniors. Breaking that down a little bit more in the 60+ age group, just because mortality can vary greatly as you get older. When we look at the 60+ age group, they are certainly following the same overall curve as the community is. The 70 to 79 age group, a little bit less so. But the 80+ age group did have the most cases that they've seen in a week, with 32 people over the age of 80 getting COVID in the past week. Again, there's not that many people in the 80+ age group in Grand Forks, only about 2,000. And their rates right now are following the general rates that we are seeing. The part where that gets scary is when we look at the mortality rate. Individuals over the age of 80 in North Dakota who are getting COVID, about 15% of them will ultimately pass away from COVID. We've seen increases in our hospitalization rates. The increase may be due to two reasons. One, the increases that we're seeing overall in the hospitalizations in Grand Forks County. Or two, I have been working with the state to try and improve the data reporting for hospitalization. So we are getting closer to what we're actually seeing. So though we see a big or kind of a dramatic increase in hospitalizations, I think that is a multifactorial increase that we're seeing. Because we are improving the way that we are reporting our hospitalizations. But again, we're in third place in the state, looking at of our peer counties, looking at hospitalized cases per 100,000, which we have seen a very dramatic increase. That was an area of pride for us that we've been fairly low, but that has changed over the past week. And I also wanted to take a look at our incidence curve as well. So the incidence curve looks at the number of cases in Grand Forks County since the start. So Grand Forks County had our first COVID case on the 29th of March. And so that was 224 days ago. This is the number of cases that we've seen since then. So we're nearing 6,000 total cases. The big take home that I want you to take from this slide, though, is looking at the doubling of cases. The lines give you a nice look of the essentially the slope or the rise over the run of cases. So we started out, it took us 80 days to double, going from 200 to 500 cases. Then that went down to 35 days to add 500 cases, then down to 28 days to add 1,000 cases, then 39 days to add 2,000 cases, and now we've added over 1,000 cases, almost 2,000 cases in just 11 days. So what you're seeing is exponential increase in the case growth. Last week I did talk about the doubling time. Our doubling time today for Grand Forks was 22 days. So based off of what we've seen in the past 14 days, we can expect our case count to double in the next 22 days. Giving a little bit of an opportunity to look back on the last slide, I talked, our last kind of doubling day was the 28th of October. So I did want to look back at that day to kind of give you an idea of where we're at and progression to the doubling from there. So the estimated doubling time on the 28th of October was 26 days. And so we're about a third of the way there towards that doubling. And so we can expect about 8,000 cases by Thanksgiving again. Last week I said, between 8,000 and 9,000. This is very much an estimate, but we can expect at least some sort of a doubling by that Thanksgiving timeframe, and then those continued doublings after that if things go the way they have gone. This isn't any sophisticated modeling into the future. This is just projecting based off of our previous experience. With that comes the concern of deaths. I did adjust our death estimation down a little bit because I used a different time frame to look at our cases. So based off of where we were at on the 28th of October, we can expect to add an additional 19 deaths by the 23rd of November, an additional 57 deaths by the 18th of December, and 133 by the 10th of January. Again, those are additional deaths to what we've had. And one thing to think about with this is Grand Forks has been traditionally relatively low in our death rates, partially because we've had younger group of individuals getting COVID, and partially I think because we have been very aggressive and had good hospital capacity. If we see a lot of individuals in older age groups getting COVID, if we start having greater constraints on our hospital capacity, we could see that mortality increase, and we could see additional deaths as well. This is the slide I was referencing earlier, looking at the mortality rates that we've observed in North Dakota based off of the cases that we've seen. So in that 80+ age group, in the lower right corner, you can see it says 15.1%. So that's the chance of a person above the age of 80 dying if they do come back positive for COVID. So that rate is very high in that age group, but there is still a risk even down to the 10 to 19 age group. If an individual gets hospitalized, that increases their their risk of dying significantly. If they advance in age, that also increases the risk of dying. Finally, we did pass another unfortunate milestone today in Grand Forks. We did move into the red on our 14-day average percent positivity for Grand Forks. So to move into the red on the Smart Restart guidelines, that required us to go over 15%, and we hit 15.1% for today. When you look at that over time, we have seen sustained increases. The governor's graph, 14 days at a time, it does make for really smooth and pretty lines. But again, when we look at our percent positivity, this is the highest we've ever been for our percent positivity when we look at it on a 14-day basis. The concern that gives me is looking at our dashboards. I now no longer have any other warnings available through the 2 dashboards that have been widely reported out by me, aside from hospital status or reductions in testing. So we've maxed out our case rates, we've maxed out our percent positivity, we've maxed out our percent change. We've seen increases in our hospital status, and fortunately, we haven't seen decreases in our testing. So the only other 2 kind of warning bells that are built into this would be for Altru to see an increase in their hospitalizations or additional constraints on their ability to provide services, or if we saw a dramatic decrease in testing to the point of less than 2,200 tests per week, where we're doing close to 8,000 per week. So that would be an absolutely dramatic decrease in the amount of testing in Grand Forks. So I'm kind of running out of options to provide advanced warning to the group. One thing I did want to bring up though is what could happen, if we continue to see increasing burden on Altru. This is a little bit of a, this is intended to be a little bit of an alarmist slide. But I want everyone to be aware, with seeing exponential case increases, the chances go up that, that we could rapidly run out of our hospitalization capacity, even if the number of people getting COVID is relatively low compared to hospitalization capacity and things like that. So when we look at what happens if Altru hits tier 3, or the governor deems it necessary to waive the standard of care. These are some of the things that I've pulled out of the state mass patient population or mass care plan of things that options that hospitals could take to increase the number of patients they can see with the staff that they have available. Some of these things are already happening in parts of the state, just as part of trying to avoid reaching level 3. But I just wanted to give you an idea of what kind of trade-offs that we could end up seeing as a community if we use purely the hospital system as our final warning before taking action. Some of the things that that have been coming up in the state are using EMS personnel to provide staffing. That's already happening in the Minot area, or they have been strongly exploring that. Nursing homes retaining sick patients, moving individuals to different levels of care, such as what was reported in the news this past weekend of Sanford and Fargo moving a large number of individuals to a nursing home in Arthur. These things will end up happening if we allow the the hospitalizations to be kind of our final stopgap, because it's difficult for us to hit stop and have hit stop and then have the case rates just absolutely stop right there. We would still see additional cases, even if after we hit stop. With that, I'm open to any questions that you may have. I do have additional slides available, and they will be on the Grand Forks City Council meeting agenda. So if you did want to view any of those additional slides, that would be the best place to see those.
Thank you, Michael. Does anyone that's participating or in the audience have a question of Michael? Doesn't have to be just commissioner. Okay, hearing none. Thank you, Mr. Dulitz. Appreciate your update. Okay, the next item then is that I'd like to call on Dr. Joel Waltz, who's the Grand Forks County Health Officer and is also family medicine physician with Altru. And I'll just ask that Dr. Waltz share a little bit about himself, his work and explain his role and responsibilities as the Grand Forks County Health Officer.
Hello, good afternoon, everyone. Thank you, Commissioner Knopf and the rest of the commission for having me. I'm a family physician. I've worked here at Altru for 23 years. The past 3 years, I've been doing outpatient only practice. The first 20 years, I did hospital work. I did my training at UND in undergraduate medical school and my residency. And that's the basics about where I'm at. As far as my current role, I've been serving as the health officer for 5 years. And part of that has been, mostly that has been involved with being on the Board of Health and supporting the health department. And things have changed dramatically here in the pandemic. So it wasn't something I ever anticipated I'd be doing, but here we are. So you asked something about, my role as the officer. I think you kind of put it out there. I do have some authorities that are granted to me through the state health officer. So the local mandates that I can put forward are basically an extension of the state. And so that's pretty much, I guess, what I have to say about that.
Okay. Anything else you want to share?
Yeah, I guess I've got a variety of things. I mean, I can lead off with some things. In regards to a mandate, I explored the idea a little bit about a month ago, and I kind of paused, and through interactions, it was kind of my hope that ongoing educational efforts would help, and the encouragement from our leadership. And well, it just hasn't happened. And as you've seen, Michael showed, the numbers really tell the whole story. So I'm here today anticipating moving forward with the mandate, and I'm, looking for input to a degree, but it's very concerning, as you all know.
Okay, any questions for Dr. Walls at this point? You'll have another opportunity, but.
It's hi, I'm Ms. Koff, Stephen Weiser, President of Altru Health System. So Joel is a colleague, friend, and fellow challenged healthcare provider working in a pandemic neither of us thought we would get into. I'll just say, Joel, whatever you think is an opportunity for us to help quell this and flatten this curve, which everybody knows we absolutely need to try to do and might take some serious measures, we will do our best at Altru here to help support that regionally as well as in our city, to make sure that as best as possible we can have that happen, because we are facing numbers that none of us want to even think about in the next few months, and over the next couple of weeks is our opportunity to suppress that. So I know what it's like to feel on a hot seat, Joel. I just wanted to share that with you. We're here to support you all, 200 of us physicians, okay, plus our regional team too. So
yeah, thank you. Yeah, I've heard pleas from a variety of our community partners will say to do something more, along with many citizens. And so I'm at that point where I anticipate a mask mandate, but I don't think that will be the limit of what I might, ultimately come forward with here over the next, few days if that works out. But one that might also include the pieces that are tied to the North Dakota Restart guidelines. That would mean, appropriate distancing, whether it's, social or physical distancing, and gathering size, to, again, be in step with what it means to be in Orange County by the governor, and maybe a red county.
Thank you. Thank you, Dr. Weiser. Did you have anything else you wanted to add?
No, I
Thank
think trouble, this is a difficult, probably a challenge of our lifetime right now to deal with. So I don't think there's easy solutions or necessarily right actions one way or the other. It's just we have to troubleshoot through this, make some decisions, see how they work, not fear to fail, fail forward fast, and make the next decision that has to happen. They try all different options to control this spread. So
Thank you. Anyone else? I think what we'll do now is we'll move forward with comments from our valued community institutional partners that are with us today. And I think that it would be beneficial for everyone to hear what effects COVID's had on your organization and staff, what you anticipate seeing in the foreseeable future. What are the challenges and barriers keeping your institution, staff, and public you serve prepared and safe? And then like what types of mitigation efforts would best benefit your organization or place of business going forward? I think it would be good for Dr. Walls to hear some of your thoughts on that. And so I'm going to start with Dr. Terry Brenner. Are you with us?
I am. Thank you, Madam Chair.
Thank you and welcome.
Thank you. It's a privilege to be here today with all the partners. Terry Brenner, Superintendent, Grand Forks Public Schools, along with the Grand Forks Air Force Base school districts. We have completed 10 weeks of school in a face-to-face model, pre-K through grade 12. Pre-K through grade 8, we're face-to-face daily. And at the high school level, we're hybrid, where students come every other day. In concert with that, we have a distance learning academy, which includes about 1,300 students who are in a remote virtual environment every single day. The matrix that we use to make decisions has been a fluid matrix along the way. I know when the county went to red, there was an expectation that the school district would pivot immediately and go to distance learning. And what I've shared with so many people is we've learned a lot along the way. And one of the things that we've learned is students tend to be fairly safe in our school setting with all of the guidelines that we've implemented. Certainly not perfect by any stretch, but in a majority of our cases, we've been able to physically distance. We're masked up at all times now since we've gone to the red, whether we've got the 6-foot bubble or not. Hand washing, hand sanitizer, you name it, we're doing all those things from a cleaning perspective as well. The challenge that we are having now is something that I said would probably shut us down, and that's the absenteeism of staff. We're starting to see more and more staff members identified as COVID positive, and the ripple effect that has on the close contacts is extraordinary. So we've been piecing together plans every day. Our principals are working 24/7, thinking they have a plan in place to staff a building in 1 minute, virtually changes within the next 5 or 10 minutes. So that is our challenge right now. Our school board has a meeting tonight at 6 o'clock. We're going to talk about our updated matrices and how we're making decisions. But we're also going to talk about the reality of how burdensome this has become for our teaching staff. I would say that while everybody wants our students at the campus level in the buildings, we know that's the best learning environment for teaching and learning. The ability to sustain what we're doing is highly unlikely. So we're going to be talking about opportunities that are in front of us. As I look at Michael Dulitz's graphs, there are some really compelling bubbles that happened after July 4th, happened after Labor Day. We're going to see another bubble after Thanksgiving, and we're likely going to see another bubble after the winter holiday break. So all of those things are factors that we're trying to mitigate, knowing fully well that as we stay in school, that helps our community, that helps the workforce, that keeps our parents as part of the workforce. And one of the really compelling benefits that helped us as a mitigating factor was the city taking on a resolution for a citywide mask resolution. So this conversation today from Dr. Walls, that it may be a county mandate, I think will be helpful for all of us in the long run. So we want to be a community partner. We know that when we're in school, we're a better community partner. When we have to pivot to distance learning, maybe we're not as good of a community partner in one of the silos that we look at, and that's the workforce and the economy. So we'll take all things into consideration as we make our decisions moving forward. And that would be my update, Madam
All
Commissioner.
right. Thank you, sir. Appreciate your comments, and just know we're all in this together and we'll get through this one together. So, okay. So any questions of Dr. Brenner from anyone? Hearing none, then I'm going to move to Megan Compton.
Good afternoon. I am going to share my screen. Can you all hear me okay?
Can you speak up just a bit louder,
I
please?
sure can. Yeah.
Thank you.
All right. Here we go. Let me see. Can you all see that okay?
Yes, ma'am.
Great. So I am joined today by Janice Hampshire, our Chief Nursing Officer. As you mentioned, I'm Compton, the Chief Clinic Operations Officer at Altru. There are a number of other people on the call today from Altru, one of them being our president, Dr. Weiser, Dr. Henderson, and Dr. Joel Walls, and there may be a few others. So just want to share a bit about where we're at and experiencing a lot of the same things that we've already talked about. So I'm going to spend a little bit of time talking about where we're at on the outpatient side, and then I'll turn it over to Janice to talk about where we're at on the inpatient side. So as of today, trying to get my screen to change here. There we go. As of today, you can see that our numbers have significantly increased. We talked to our staff last week about just the changes that have happened throughout the organization. So up until really the first week in October, the max amount of patients that we were caring for on the inpatient side with COVID was 10. Right now we have 41 hospitalized patients. So we've really seen an increase in the number of patients we're caring for on the inpatient side, but we're also seeing a pretty significant increase on the outpatient side as well. So as of Sunday, we had completed for a 1 week period of time, 1,200 tests, and 268 of those tests were positive. We had really before October, we had been averaging about 1,000 calls per week to our hotline. Now we're closer to 4,000 calls per week to our hotline. And we can see on this graph, the curbside tests being completed, where you can really see it follows the same trend or a very similar trend to what Mr. Dulitz provided earlier. So what we're doing to try to combat that on the outpatient side is really through testing, and in partnership with many of the institutional partners, and specifically the city, Mayor Buczynski and Todd Phelan have been really helpful in increasing and improving our testing capabilities. So until this week, we've been testing our curbside testing location at our family medicine residency site, which is on the university's campus. And it's worked really well until we're getting closer to winter and we see this increase in need for testing. It's really not conducive to those needs. So with their support, with both the mayor and Todd Phelan's support, we were able to move the testing location to the Alaris Center. So beginning on November 11th, Wednesday, we will do all of our curbside testing there. The benefit of that is, one, those cars can pull into a covered space and we can create 2 lanes, so we can have up to 30 cars inside the Alaris Center at one time. So we should see the testing turnover pick up, which I think will be really beneficial. We will be able to get people tested on a faster pace. Our hotline will continue to remain in place, and then during our hours where we're not offering that curbside testing, so the evening hours and then on Sundays, we still will have our express clinics offering testing and treatment. So really what we're trying to do is steer those non-emergent patients away from the hospital and away from our emergency room. Janice is going to spend a little bit of time talking about what kind of impact we've seen on the inpatient side. But if you all can continue to help me share the message that the more that we can keep our non-emergent patients out of our emergency room, the better off we will be. So we'll continue to have the express locations both in Grand Forks and East Grand Forks for care as well as for testing. So I am going to turn it over to Janice to give you a bit of an update on the inpatient side, and then we can certainly take questions at the end if you'd like.
Thank you.
Thank you, Megan. So I'm Janice Hampshire, the Chief Nursing Officer, and I'll give you an update of the impact to the hospital. You can see what our average daily census has been as it relates to patients that are hospitalized with COVID. Matches very much Michael Dulutz's slide, where you see kind of that rapid rise in the last 2 weeks. And in fact, we now are over 40 inpatients. I would say the good news about that is that only about 15% of those hospitalized patients require critical care. But we are seeing significant increases in terms of the numbers of people that we are seeing requiring hospitalization. Megan, can you go to the next slide? So the impact is, we're seeing more people coming in and seeking testing. We're seeing more hospitalized patients. And much in line with what we're seeing from a community perspective is we're seeing higher numbers of our Altru employees on quarantine. So each day we complete a screening that consists of our temperature, any symptoms we may be experiencing, exposure to somebody that has been positive or who is testing, as well as any international travel. And based on that screening, if people are cleared to come to work or their contact employee health, and they may need to be out on quarantine, meaning that they can't come to work. And so we are seeing higher and higher numbers of our employees impacted, requiring quarantine because of symptoms, exposure. Usually it's community exposure or someone in the household who has COVID. And so staffing is becoming much more challenging in order to provide adequate numbers of people to care for our patients on the hospital side. As it comes to resources, early on in COVID, we certainly heard a lot at a national level that there were shortages of everything, but we have hospital beds. We have adequate amounts of PPE. We have the medications. We have plenty of ventilators. The things that are, I guess, tighter in terms of a resourcing are the number of testing kits that allows us to give our patients and our employees faster results are limited. And then the impact on our staff, really causing us to pull on all kinds of levers, shifting teams that typically work in the outpatient or ambulatory environment, bringing them in to support the hospital teams. We are now beginning to critically look every day at patients who are scheduled for surgery that are going to require an inpatient bed to determine, do we have the staffed bed capacity to allow that surgery to happen? And so I would say our staffing limitations are probably our biggest limitation, again, as a result of people that need to quarantine. So, as I think about, we're 8 months into this journey with COVID, and I'm sure, like many of you, there's just a lot of fatigue around the impact that it has had on us at a personal level, but now more than ever, it's essential for masking, physical distancing, and hand hygiene. It's what we're going to be able to implement in order to prevent the spread and to really control this within our community so that we do have the resources to be able to care for people that require hospital care. And I think we'll just open it up for any questions that anybody may have for us.
Janice, before we jump to questions, I might just add around the testing kits a bit of an update. So last week, with the support and the help of the city, the mayor and Todd, we were able to get on a call with General Dorman from the state and working with him to increase the number of testing kits available right within the community so that we can do two things: test more people and then get the results back to them on a quicker basis. So I think there's going to be some improvements there, and we're looking forward to being able to do that. One of the things, as Janice mentioned, is this ability to understand and know who's positive within our community to slow down that community spread. So we're feeling positive about that shift, and just continue to work on the staffing needs and ratios that we have within the system. So we'll take any questions that you may have.
Okay. Does anyone in the audience have a question for any of the All True members?
I have a question. We have a minute.
Yes.
Hello, Sean McBride. I'm the regional epidemiologist with North Dakota Department of Health. Thank you, Debbie, for inviting me to join the meeting. My question for All True is, are you still able to provide same-day testing to symptomatic individuals, or are they having to be scheduled out a day or two in order to get their test?
Thanks, John. Good question. So last week, with the increased number of people that we were seeing at curbside or calling our hotline, we were having to schedule them 24 hours out. So that may not be the same day. With the change in the number of test kits, along with the ability to test them at the Alaris Center and creating 2 lines, we'll be able to go back to same day.
Other questions? Thank you, All True staff, for everything you do each and every day. And it's not unrecognized, but very much appreciated. So, okay, the next speaker we have is Garth Brylan. Are you with us, Garth?
Yep. Thank you, Diane. Thank you, commissioners. I'm the president and CEO for Valley Senior Living. We have 2 nursing homes, 1 assisted living, 1 basic care, a couple of independent livings here in Grand Forks. We have about 880 employees, about 500 people each day that live within our walls. We have had 12 people pass away due to COVID over the course of this pandemic. And they've come at times when there's been community spread. So the first time that we had people pass away, it was when we had that outbreak back at the end of April, beginning of May. The next time we had an outbreak, it was August, when we had that big bump in the community. And then we had another outbreak now in October that we've dealt with. So, you know, as the community goes, so goes long-term care. And that's been proven over and over throughout the country. So we would absolutely wholeheartedly support a mask mandate and anything that the county could do to try to slow the spread. What's probably the most concerning, even though things right now are okay here at Valley, is that my counterparts in long-term care across the state, it would be very normal to look at the dashboard and see between 50 and 100 residents who might be COVID positive across the state, maybe 200 on a really bad day, staff positive. Today we have 600 residents that are positive for COVID across our state in long-term care facilities, and we have 800 staff. So this does happen, community spread, household transmission, gets to that healthcare worker who's providing a lot of really close personal care to the residents, and it does spread. And many of these outbreaks right now are in our region, and it's a very scary time. So I think the mask mandate has a low economic impact when you look at the big scope of things. And I know there's a lot more that Dr. Walls is probably considering, because that right now is just one thing that can be kind of thrown at this. I'd like to just introduce Dr. Chris Henderson. He is our medical director and an all-true physician, to make a couple of comments.
Thank you.
Thank you, Garth. Can everybody hear me okay?
Yes, we can.
Okay. I'm Dr. Chris Henderson. I'm a family physician at Ultra, just like Dr. Walls. I was trained at UND. And here at All True in Grand Forks, I've been serving as the medical director for Valley Senior Living for the past couple of years. So just sort of want to echo a couple of Garth's comments about the outbreaks sort of increasing in frequency. You know, we had a big one in August, smaller one in September, another big one again in October. And some of the indirect impacts are probably one of the things that we're feeling a lot. Around a month, I think, ago now, we sort of closed off visitation again for our residents. So for the most part, they can't see anybody. No family members or anybody can come to visit except for pretty extenuating circumstances. And that's having a pretty negative impact on their health, both mentally and physically. And, you know, community levels are sort of at a level right now where we couldn't safely restart that. I think some of the other indirect things is sort of what I'm managing medically here that's not COVID related because of hospital capacity. Just in terms of other medical issues that are common in our population, I'm sort of doing more here than I have historically in the past in order to sort of try to take the burden off of the system. But a lot of these patients would potentially do better in the hospital, but we really sort of, as part of sort of being a community partner, we sort of keep what we can here. But it's been a little bit challenging for that. So, and then just sort of the drain that we're seeing on our staff, especially those of us who have seen a lot of COVID patients. These people get, you know, we know these people pretty well. We spend a lot of time with them. And it's pretty hard for us to see them get sick and then die at the rate that patients in this population tend to do when they get symptomatic COVID. So I certainly do appreciate the county's willingness to do this. I don't envy Joel his decision, but I do think that some of these mitigation measures that we've seen elsewhere that have worked, and things like mask mandates, things like reducing gathering sizes for things like, you know, weddings and things of that nature, I think can certainly do a lot to turn the curve the other way, so that we can sort of start breathing a little bit easier here at the nursing home and in the hospital.
Thank you, sir. Appreciate it. Any other comments? Okay. The next, Dr. Armacost, are you with us?
Hi, Madam Chair. This is Tom. I don't actually see anybody from UND on, so
Okay.
I think you could move on.
If that changes, let me know.
I will.
Okay, and then Colonel Pringle, are you with us?
Yes, ma'am. Thank you for the opportunity.
Welcome.
All right. Well, I appreciate the opportunity to just say thanks to this great group of folks. Never pass up the opportunity on behalf of the Warriors of the North to say thank you to this community for the amazing support we received throughout the year, particularly in these conditions. We want to make sure that we reach out and say thanks publicly to our partners in the medical community for the amazing support that they give. All of our airmen and families, a relentless commitment to quality care, and particularly applaud the transparency that we've gotten from our partners in the medical community. On base, you know, our commitment and our priorities are just a little bit different in the sense that, yes, we're going to care for our airmen and families. We're going to preserve mission capability because that's really why we're here. And then obviously we want to be responsible members of the community. So that mission prioritization drives us to be a little bit more restrictive. You should always expect that the base will match or exceed the restrictions that exist in the local community because, again, of the requirements of our mission. So with the rising cases on the base, we have recently declared a public health emergency on the base and increased our health protection condition to level Charlie, which for us basically equates to the risk levels that you're seeing in North Dakota Smart Restart and in the city. So broadly matching where you're at, I've put a couple of additional restrictions on the airmen in order to, again, preserve that mission capability. But I just want to emphasize that we're getting the mission done. and we want to be supportive members of the community. So you should never worry about what actions you take in this body being an impact on the base. We're part of the community. We're supportive partners, and we'll be out in front and more restrictive in all cases. So we appreciate the opportunity to again say thanks to the community for all the great support, and proud to be here with you today.
Thank you, Colonel. Much appreciated. Mayor Bochinsky, are you with us?
Yes, I am. Thank you.
Thank you. Welcome.
Well, first, I'd just like to say thank you. I mean, everybody here, we've been in this fight for 8 months now, and it's certainly draining and certainly appreciated. Definitely want to give a great thanks to Altru. I think the level of care that they've given has truly saved lives, and they've also, you know, the therapies have managed to move people through the hospital quickly, which is pretty amazing. When talking with General Dorman, I believe it was Friday, just the Altru with their hotline and the testing that they've been doing isn't happening anywhere else in the state. So that's just really phenomenal to hear that from a coordinator on that level. As far as the city of Grand Forks, we're definitely committed to delivering services. We've got public safety and public works. We got to keep policing. We got to keep collecting garbage, providing water, collecting wastewater. We've had staffing issues, but we're certainly going to continue to provide those critical services. You know, I think the community, we've all been waiting for the response from the community. It probably hasn't happened as quickly as we want, obviously. And in the end, any of the mitigation that we do, if people aren't taking the responsibility on themselves in their private settings and in their homes, it's not going to matter. You know, we've instituted a number of mitigation strategies and efforts. And, you know, even looking at other countries, looking at Germany, looking at the UK, places that have really done, you know, probably better than us at mitigation, and they're, you know, currently in lockdowns at this moment. So it's certainly a tough time, and I think at times like this, you know, a lot of it's just holding things together, keeping people in the fight, and keeping the community from ripping at the seams, and that's what we're dedicated to do here at the city, and we'll continue to do. Todd, maybe you're always good at filling any gaps that I missed, so go ahead.
No, I would reemphasize what we heard from General Dorman, who's leading some of the testing and analytics, is that, you know, it's great to hear that Megan said that they've moved forward with providing more testing in our community, and really gave Altru a huge shout out of doing things that no one else is doing in the state. And I think that's why we have performed better in many different ways. So thank you to Altru Health System. I would say this, Mayor, you did do a early bar closing. I don't think anyone's followed suit, but there's other communities that are thinking about that. But what we heard from small business owners is this has been tough on them, and they want to know, they wanted to make sure policymakers like, you know, that they're willing to sacrifice as part of the greater good of the community, but they want to know that they're hurting. And so that when you look at, as we move forward economically, that we take that into account and we do what we can, whether it's at the state or federal level, to fight for them and to fight for their livelihoods because they are suffering. So on the economic side, and as we've said from day one, this is a public health and an economic matter, and they have to be balanced and both have to move forward. But that's what we also heard last week, that we have lots of community members and business owners that get it. They have to do their part, but they don't want to be forgotten and assumed everything's fine with them too. So that's further comments I would provide, Mayor.
Thank you, gentlemen. Anyone else have any questions of the city?
And Madam Chair, President Armacost has joined us. Okay.
And so pretty much everyone that has spoken, the schools, Altru, Valley Senior Living, University, well, not the university yet, but the Air Force Base, have indicated a willingness to support a mask mandate. Is the city on board with that?
I think we need to see further what else is in it. You know, we've had 2 weeks under our current mask resolution. I think we need to start thinking beyond just masking. I think there's a lot of other things that we need to look at doing.
All right, thank you.
Yep.
All All right, Dr. Armacost, are you with us?
I am. Thank you for allowing me to join you.
Thank you. Welcome.
Thank you. Thank you. And I've spoken before about what we've decided on campus to do, and that is to enforce masks and mask usage, as well as other prevention measures that are fairly common. But we would be very strongly in support of any measure that brings the citizens off campus, and in particular, the behaviors of our students and faculty and staff off campus in compliance or in consistency with what we do on campus. And so any form of mask mandate would be entirely consistent with the direction that our campus has gone. And so we would be in favor of such a measure. I think it's a proven measure of keeping everyone safe, and we would be in support of the county making such action.
Thank you, sir. Does anyone have any questions of Dr. Armacost? Okay, thank you. Okay, so if there are that's the extent of our institutional or community partners, I believe, unless I've missed someone. And from there, we'll just move into comments from our public comments. And so I just want to note for the record that this meeting, of course, was noticed, and that everyone was advised that anyone wishing to speak at this meeting today should reach out to Mr. Ford by 3:30 today. And so just to let you know, Grand Forks County Commissioners have received numerous email comments from the public relating to the passing of a face mask mandate, which all have been provided to Dr. Waltz prior to this meeting. So we'll now open the meeting, or this portion of the meeting, for public comment. And I would request that comments be kept to a minimum. And I'll ask Mr. Ford maybe to be our timekeeper there, depending on how long they go. We have, to my knowledge, 3 individuals that wish to make comment. And we'll start out with Terry Bierke. Terry, are you with us?
Yes, I am. Thank you. I'll go quickly. The questions will go fast. The answers will be dependent on the people that answer. Number 1, considering social distancing and masking and your ability to enlarge your room at the county commission, this is for the commissioners, why are not the county commissioners meetings open to the public so we can attend these meetings in public and ask these questions?
Terry, we're just opening it for comments, not for questions at this point. This isn't a debate. It's basically.
So it's a meeting where I can't. Okay, I guess I'll make my comments since I can't ask questions. I guess it's appropriate. Kind of reminds me of China. All right, my other comments. If masks work, I would ask the question for the medical people: how are the cases, hospitalization, and deaths doing in Minnesota, which has a mandate for months? If I could ask question, I would ask the state's attorney, who would be responsible if a lawsuit is brought, if there is not an exemption for religious services to get out of this mandate? Who's going to have to defend the lawsuit, and who's going to pay when you lose? The other question I would ask the state's attorney is, if this becomes a criminal offense, do the people have a right to a jury trial, which is going to have an impact on your prison system, your jail system, and your court system? And from what I understand about juries, it takes one person to be not guilty, and then you have a mistrial and you have to redo it. I also would know in general what kind of exemptions are going to be on there. I have the city resolution with numerous exemptions, so I asked for something, apparently nothing's written yet, so I don't know what you are or are not going to exempt, but I hope that's taken into effect. I would also mention that the nursing homes are heavily restricted as far as visitors, masking, protective gear, temperature checks, on and on and on, but it still gets in there. So that's just some of the questions I have. I would have more when I have a document I could look at, but I would temper this request with, remember, this is America. Liberty is important. And I guess I would say also, the best way to make a bad mandate go away is for people to decide to make you have to enforce what you pass. So be very careful what you do. Thank you.
Thank you, sir. Appreciate your comments.
Madam Chair,
yes,
if I may just briefly respond to Mr. Bierke's questions, I
absolutely
answer some of them for him. Mr. Bierke, as you're probably aware from your prior experience with the city, is that most municipalities and political subdivisions in North Dakota are insured with the North Dakota Insurance Reserve Fund. So anytime a government entity is sued for any type of alleged violation of the law, that insurance reserve fund kicks in, appoints an attorney, and represents the public entity in that matter. This would be no different than any other type of lawsuit that could be filed against a government entity for any variety of reason. And so then any payment made would be made from that insurance reserve fund. As to your second question, any violation of a health officer's order of any kind, whether it be a mask mandate or otherwise, is classified in state law as a Class B misdemeanor. All Class B misdemeanors entitle a person to a jury trial. So yes, that absolutely would to anyone that was prosecuted for any type of violation of a local health officer's order. With that said, I would note that I know there's a lot of apprehension about clogging up the judicial system and whatnot. And I myself had some questions and concerns about the same. And in preparation for those concerns, I have had contact with law enforcement, particularly in Minnesota, as you had indicated. And I initially reached out to our colleagues in Polk County, Minnesota. They indicated to me that with relation to the mask mandate in their jurisdiction, they have not had one case prosecuted. And their law enforcement has been minimally impacted, which I was very relieved to hear, because I don't think any of us want to see anyone in our criminal justice system. I suspect Mr. Waltz and the commissioners likely just want to see compliance with mask usage. And I think on behalf of law enforcement, it would be no different from our perspective as well. They also asked that I reached out to their Minnesota County Attorneys Association with my inquiry to see the impact statewide. They also reiterated that the impact was extremely minimal statewide, and that there were hardly any, if any, prosecutions in the state of Minnesota. So I would be hopeful that the citizens of North Dakota would take a mandate the same and have minimal impact on our judicial system. I hope that answers your questions.
Thank you, ma'am.
Thank you, Ms. Fonstad. Appreciate it. Next comment is Dr. Is it Flickinger with us? Tom, do you know?
He might be muted, but I don't. There are some phone numbers on here. One could be his. Maybe give it a sec, to one more chance to see if he's muted. I think you're probably safe, ma'am, to move on.
All right, thank you. And then Ron Franz, are you with us?
Doesn't look like it.
Okay, all right. Okay, so with that, then we've heard all the public comments. We'll move to discussion between Dr. Walls and the commissioners. And so I'm just going to open it up to the commission with respect to questions that you might have of Dr. Walls.
Excuse me. I wanted to make a comment just in support of Dr. Walls, if I could. I didn't want to interrupt, but I hope that's all right.
Thank you. That's fine.
I wanted to just mention that I support Dr. Walls in any mitigation measures that he would think are necessary. I think right now we're at a point where Masking has been shown to work. If we look at the situations that Dr. Terry Brenner outlined as far as the mitigation and prevention in schools or healthcare settings, I mean, these are a very low cost effective measure to prevent spread that we've seen work in many places where they are used. I think we're at a point where, as we see the number of cases and the surges that are occurring, our methods of prevention and mitigation have been primarily testing and contact tracing. As the burden increases upon those things, we're going to see greater delay in follow-up, which we are seeing diminish the effectiveness of those things, meaning we need to utilize more community-based mitigation measures. And a mask is probably the simplest and most effective means of doing so. And I would also be in support of other measures that Dr. Walls feels is necessary in order to protect businesses, to protect health, and protect schools. I think at this point, no action or inaction is making a choice. We are choosing certain things over others because we are seeing daycares affected. We are seeing long-term care affected. We are seeing healthcare affected. There are people being impacted beyond just business. Business is important. And I think we can accurately, or excuse me, my children decided to interrupt me. I think we can make decisions that allow everybody to be looked out for and to preserve all of those things, which is life, health, and livelihoods. And a mask is a big part of that. Thank you.
Thank you, sir. Can I just ask for your name, please, for the record, if you want to give it?
My name is Sean McBride. Thank you.
Thank you. Appreciate it. Anyone else? Okay, I'm going to move to the commissioners. Questions that you might have of Dr. Walls?
Chair?
Yes.
I have a question or a comment for Dr. Walls. Dr. Walls, Debbie Swanson did a nice email recently giving us information on the number of COVID positives that are throughout the county in various towns. I have to admit that when I received that and when I opened it, I was quite surprised that we saw the numbers in our smaller communities throughout the county. And I hate to back you into a corner, but I am wondering when you are looking at doing something throughout the county, what your timeline, and I know you commented earlier that it would be a couple of days. The reason why I'm asking that is because I'm concerned that we need to do something immediately. And even though we visited with Haley Wamstead, our state's attorney, that we don't have anything that we can mandate. We can put out a resolution to mandate mask wearing throughout the county, but we have no way to encourage that or to penalize anybody for not wearing a mask. I would certainly be in favor of passing a resolution immediately so that we could start getting the information out to our county residents outside of the city of Grand Forks so that we can encourage everybody to wear masks even before our county health officer does make such a mandate. So I guess, I'm sorry, I'm being kind of long-winded, but I guess my comment or my question then, Dr. Waltz, is what is your timeline at looking at making a decision of this magnitude?
As far as the timeline, I'm, hearing everyone, and I had a pretty good idea coming in where most people stood on a mandate. So I haven't heard really any opposition. So I'm hopeful that a few different models that I've looked at will quickly, make it to our state's attorney's hands to, make it as legal, and I don't know how long it will take, but I anticipate getting the information to her in the next day or so, and waiting for whatever revisions need to happen. So I don't quite know how to say more than that, but I'm ready to move as quickly as we can.
Thank you.
Thank you very much for your comment.
I just want to make a comment. It's my understanding that if Dr. Waltz declares a mandate, that it has the full force and effect of law. And so I'm not sure, and maybe Haley can answer this, if we as a commission would even have to do a resolution, because it's his decision. You know, our responsibility is to support that, or, you know, let him know if we support that. But but there is work that needs to be done. And there is notification that we'd like to give to our public. Absolutely. You know, but I think that, Haley, I don't know if you can speak to that or not, but, and I also know that you're working with the city. And so do you have, if the mandate was, if Dr. Walsh said, yes, I'm going to do a mandate, what do you anticipate for a time period of what you might need, given what you know at this point?
Madam Chair, this is
Yes,
Commissioner
sir.
Paul. Could I interrupt just briefly?
Absolutely.
You know, to answer part of the chair's question, I think it is important that the commission decide on a mandate, notwithstanding that Dr. Walsh is looking at implementing, because I think that shows support within the community and from all of the partners within the county and within the community of Grand Forks. And I think it's important that we move ahead as quickly as possible. And I keep thinking about the old quote, which I think is attributed to Einstein, which says, the definition of insanity is doing the same thing over and over again and expecting a different result. And that's kind of what's been going on for quite some time. And our result is not different. In fact, it's getting much worse. And it's really quite frightening. And I think particularly frightening to the medical community, because I keep hearing the word unsustainable. And it's certainly, that word describes what's going to go on, because there just aren't enough staff. We can't hire nurses right now, and I'm sure All True can't find them either. So even if they put up beds, they're not going to have nursing staff. So I think it's critical that we move really at light speed right now. Masks are a good start. I think we should encourage our businesses to have people work from home if possible. That doesn't diminish their productivity, and a lot of businesses have been doing it and are able to do it further. The test kits are a positive, and General Dorman is great. We've worked with him since he lived in Grand Forks, but those test kits may not be with us forever. Other areas of the state are going to have similar demands, and they're going to chip in to the number of those test kits unless that number is such that they can supply the whole state, which I doubt right now. And, you know, the economic side, I am very concerned about businesses, but then I remember reading some of the notes that we received here from people that are just very concerned about their health. And the one thing that keeps coming forward is they say they're staying in their homes. They're not going out, and they're not going to spend any money in our community until this is brought under control, other than for groceries. They're just not leaving their homes. So our economic status at best is only going to get to somewhat of a poor to fair level. It's never going to be average or great until we can get these people feeling comfortable about going back into the community. So I guess those are my comments for right now. With respect to masks, I think it's very clear from the medical community and from scientists, and we have to believe in science, that masks work and that they're important. And I'll go back to the fact that when you have surgery, if you're still awake when you go into the surgery room, everybody's got masks on. And that's not necessarily to protect them, that's to protect you as the patient. And that's what masks do, is they protect others from you generating that disease to them. So, you know, who wouldn't want to wear a mask if they thought there was a reasonable chance it might save someone's life? Even if it doesn't, just a chance that it might. It's a small imposition. Thank you. That's all I have.
Thank you, sir.
Madam Chair, this is Dave.
Yes, David.
This is Commissioner Engen. Dr. Walls, as a commission, we can, I like the idea that we would do a resolution that in advance supports at least the mask mandate. I'm curious as to what other provisions you think or that you are considering and how far they would go. You know, we have groups and businesses ranging from health centers to churches to other organizations to daycares to schools. How do you see some of the things that you've got in mind applying to those situations? Because in the governor's statements, I think some of the restrictions based on the color of the county and so on are not really being followed.
So that is sort of my point, I think, is that they're not being followed. And so, yeah, I wasn't going to go in very off of what is in the, restart guidelines. There might be a few exclusions, but what you see like for restaurant industry, for right now, it's curbside pickup, takeout recommended, and probably what should be done, but I don't think I would, go that far as to say that, we can't do what they're doing now, but I'm not sure. I think maybe a lot of restaurants are complying, but I think there are others that are probably over the 25%. So I think, with the mandate, it adds more, of course, clarity to, these are, guidelines set forth by the governor. This is what's expected, and, we should be following them, and it's just not happening. So I'm mostly just want to see those guidelines, as they are right now. I don't have any intentions at this point to make a statement about schools. I think they can sort of, make a good decision on their own. I can, certainly step in at some point, but for right now, I think it's, the distancing that needs to be happening at those different, workplaces and then limiting the gathering sizes as well, whether it's, I guess I have to get all the specifics in there, but I wouldn't go beyond what's in there right now.
Anything else, David?
Well, I'm curious as to how we would get all this information out to get the people who aren't paying attention to the numbers of people gathering, for example. Will this all go out to mayors and then they will disperse information within each of the small towns? I live in Northwood, which is a small town. I don't live in Grand Forks. So, I mean, how does this word get spread, and how is it enforced? I guess is the question too.
I mean, I think, like all of this, my hope is that, this is compliance based first, and hopefully, when there is if someone notices that things aren't being done, it would be complaint driven so that appropriate people could, let that institution or wherever it is that, there are expectations that, if you didn't know about them, well, here's an opportunity to educate them so you can change. That would be my thought of how it should work and hopefully would. If someone is flagrantly disregarding these on a repeated basis, well, I think there could be ramifications that, of course, would, involve, more important legal.
Can I just make a comment? And I know nothing about the legal end of it or, the medical piece or whatever, but I'm just curious. Okay, if Dr. Walsh signed a mandate, do you have a document that is already there that kind of spells out or lays out? And you can add or delete or change it, whatever to your liking. But I mean, don't you have some kind of document that, I mean, if you make a mandate, could you sign it tonight? Is there something you could sign tonight that would show face masks are mandated tomorrow? Or not? All right, I'll give you 2 days.
Yes, I could. I'd like to get some additional input to make it, appropriate. So I think I have the vast majority of the substance that I want in it, but I don't know that it's refined to be, launched for, prime time tomorrow. But I think
Yeah, okay.
have enough.
But you've got a base there that you will work with, or that you can work. I'm sure the State Department has provided those sorts of things, made those available for mandates of some sort. But so within a few days that could be done. And then my other question is, if this is a Class B felony, okay, so that comes with
Misdemeanor.
It's a misdemeanor.
I'm sorry. So see, now you know how little I know about law. So with a Class B felony, that comes with your mandate.
No, it's a misdemeanor,
No, I'm
Diane.
sorry. Let me write that down. Misdemeanor. I'm sorry. So with this Class B misdemeanor,
there you go.
And your mandate that's tied to that. I'm trying to think what my question is here. I'm getting so flustered about mandates and misdemeanors. That has to be enforced, does it not, by local police, sheriff, law enforcement? I mean, isn't that part of the letter of the law? I mean,
Madam Chair, I can answer your question. So because state law provides that a violation of a local health officer's order is a Class B misdemeanor, law enforcement would be the arm of government that would be the enforcement mechanism. With that said, like I stated earlier, I myself don't want to see any citizens involved in our criminal justice system for this. I think it's probably fair to say our law enforcement feels the same. And so, I think law enforcement officers always utilize discretion based on the circumstances of whatever is presented to them. And so they certainly could utilize discretion. And when I visited with our colleagues in Minnesota, they indicated that was a priority in their jurisdiction when they were called on to enforce this, is that they would use it as an opportunity to educate the citizens rather than issue a citation on the initial complaint that they received or the information that was brought to their attention. Likewise, our office, if any matters were referred to us, prosecutors have discretion as well. We wouldn't be looking to impose jail time or any grave sanction. In most circumstances, I would suspect we may be asking the court to impose some type of fine or something along scenarios. Obviously, every case is different. Some situations may be more egregious than others, but that would be kind of a brief summation of the enforcement mechanism if this mandate came through an order of the local health officer.
thank you. So, any other questions for Dr. Walls?
Madam Chair, this is Adam Kurtz from the Grand Forks Herald. I was wondering if I could have a moment.
Had you made a range, Mr. Ford?
I did not, ma'am.
Okay, I'm going to say no, Adam. I hate to do that, but we had spelled it out in our public notice, and I'm sorry.
I understand. Thanks anyway, Diane.
Thank you.
Madam Chair, this is Dave. Dave Engen.
Yes, David?
I know that everyone on the commission has seen the resolutions done by Steele County, Trail County, and maybe even Nelson County. Is that a format that's being used statewide? Where did these forms come from? Because the two I have in front of me are exactly the same and they're quite thorough. Anyone know?
Commissioner Engen, members of the commission, in speaking with other state's attorneys across the state, it's my understanding that 2 of those counties have a joint state's attorney. And so the drafting of those documents were very similar in that regard. And a 3rd county that issued an unenforceable mandate utilized a lot of the language from one of those 2 prior counties. And so I think that's why at least 3 of them are very similar. I can't speak to others. I haven't seen any others, but I think that maybe explains why they're very similar. And I don't know, I haven't yet seen Dr. Waltz's draft. I don't know if his is similar to those as well. However, Mr. Gosted, city attorney, and I have visited, and we both, since Mr. Waltz's position is a joint city county position, he and I both would like to review any draft that's put together by Dr. Waltz to provide our input on any legal ramifications that may arise.
Thank you.
Any other questions from commissioners?
Madam Chair?
Yes, Ms. Peach.
I don't have a question. I guess I have a comment. In light of the fact that our state's attorney will be working with the city attorney and Dr. Waltz in putting together the mandate that he is going to issue throughout the county of Grand Forks, I would suggest that we don't make a resolution and just support the resolution that's going to come forward from our public health officer.
I don't think that we had to make a resolution, did we, Haley?
Madam Chair, members of the commission, that is correct. The authority of the health officer is within his sole discretion. You know, I certainly think the commission's comments are maybe helpful to his decision, but there's no need for any type of formal resolution or motion. Additionally, the meeting that was noticed today did not call for any type of action item. And so it's more just for discussion and gathering of information.
Madam Chair?
Yes, ma'am.
I do understand that. I'm just stating that I think, and maybe I misinterpreted what Commissioner Falk was stating, but I believe Commissioner Falk was stating not that we had to do a resolution, but wanted to do a resolution to provide support to Dr. Waltz's resolution or his mandate. And so I think that in this, since our state's attorney and since we are, I think, in full support of this resolution or mandate coming from the public health officer, that we gather this information, thank everyone for all of the work that we're doing, and wait for that resolution to come forth.
Ms. Wamstead, are you fine with that?
Yes, thank you. That would work for me.
So, Commissioner Falk, do you want to make a motion then to that effect? That we are in support? Well, we don't know what the decision is yet.
Yeah, excuse me. Well, yeah, I was aware, Ms. Wamstead had informed me prior that we have a problem that we didn't notice that we might be doing some sort of a resolution or mandate or whatever. And so that would probably be inappropriate at this time. I guess I think it's quite clear from the record that the commission is in support of Dr. Waltz and whatever he can do to alleviate this very serious problem that we have at the present time.
Do we need to, would it be good to take a roll call vote from commissioners? I mean, are you in support or not in support?
Madam Chair, I think you can solicit the comments of each of the commissioners, but at this point in time, I don't think there could be any type of formal action taken in the form of a vote or a resolution or motion.
Right, okay. Well, are there any commissioners that would be opposed or want to make comment about that? I'm assuming we're all 100% in, you know, wanting to see this pass, but I can't assume. And that's based on past conversations, I guess, that we've had over the last 8 months. So, okay, so what do you recommend that we do, Ms. Wamstead, going forward tonight? Just wait for, I don't know if the doctor is willing to or wanting to make a decision tonight, or we, so you know where you're going to go further with this, or?
Madam Chair, members of the commission, City Attorney Mr. Gosted and I certainly can visit with Health Officer Waltz and see the drafts of what he'd like to come up with and assist him with any language or legal issues pertaining to whichever orders he wishes to pursue. And we can certainly inform the commission of such when they're ready.
Okay, thank you. Dr. Walsh, do you have anything else for us?
I'll be planning to get to work on this. I'm not sure. I know Sheriff Andy Schneider's on the call. I haven't heard from law enforcement. I know there's always been concerns about enforcement, and I don't know if there's other things that anyone wants me to consider before moving forward, but that is my intent to, you know, make a mandate and get it, you know, processed and in place as quickly as possible.
Okay, thank you. Well, and I know law, you know, enforcement is going to be a concern, but it's one that we'll have to find a way to make that work. And so,
Madam Chair.
Yes, sir.
Commissioner Falk here. You know, I'm anticipating the public will respond positively, and I'm going to look at UND, and President Armacost has implemented that out there some time ago, and I think with great success. And really, the younger people are less affected by this, but seem willing to jump on board. So I think our general population will follow suit, and I'm not anticipating great problems with this. And of course, enforcement, I think someone talked about DUI enforcement, but we're going to lose far more people to COVID than we are to DUI. So if there has to be some enforcement, then that will necessarily have to happen. But I'm optimistic that that's going to be very minimal.
Thank you.
Madam Chair?
Yes, sir.
This is Commissioner Engen. I just saw on the side of my screen that Kari Gels has sent an email talking about Governor Burgum's a press conference, I think, that was just held. Kari, are you on the line, and do you have anything that would be of interest to the doctor?
Hi, Commissioner Engen. Members of the commission, yes, the governor did move the entire state to the orange risk level, and he has limited occupancy to 25% and no more than 50 people. And I'll have to look at the restart guidelines to see what else that entails. But I think that would be well in support of Dr. Walz's health officer order.
Thank you, Kari.
Welcome, ma'am.
Okay, any other comments? So it sounds to me, correct me if I'm wrong, that Dr. Waltz, your thoughts are is that you will go forward with the mandate. And it's just a matter of working out the details with both the city and the county. Is that correct?
Yeah, that's correct. And what I'm working on is one that's been modeled in the state. So yeah, it'll look like, another one, but it'll be pertinent to our situation, and it's hopefully comprehensive, and there'll be exclusions for masks, and there'll be I'm thinking pretty obvious things that would make sense, but we'll try to make it a very usable and clear mandate.
All right. Well, thank you, sir, for all that you do. And please know that we are behind you, and we'll work with you to make this happen along with our community partners. So appreciate all the time and the great work that you do. Thank you.
Thank you.
Madam Chair, one last
Yes,
thing,
sir.
and I hate to delay this, but actually Mr. Flickinger sent me an email and indicated that he had watched it on Facebook, didn't want to provide any other comments other than he wanted to correct the record. He's not a doctor. So,
okay. Well, that's all right. Thank you.
yeah,
I think that was my fault. I promoted him to doctor.
Yeah, it could have been mine too. So he's
doctor at Rural Health, retired doctor at Rural Health. So
whatever. All right.
Whatever. So anyhow, anything else? Any other contacts or information you want to share? Hearing none, does anyone care to make a motion, please, to adjourn?
Madam Chair, I would so move.
Thank you, Ms. Peach. Do I have a second?
Second.
Okay, we have a motion and a second. All in favor signify by saying aye.
Aye.
Opposed, motion carried. Thank you, everyone.